further action on the jobs agenda is possible, and further action on health care legislation is also possible. And I yield back to the gentleman.
I thank the gentleman. And Madam Speaker, I think it has been well reported that the majority plans to try and use the reconciliation process to ram through a health care bill to this House and the one across the Capitol. And we also know from the reports that it is imperative that this House and the House majority, the members of the majority, must first pass the Senate's health care bill before any other action on a reconciliation measure is taken. The gentleman has announced, Madam Speaker, that all this will take place next week, and I wonder if the gentleman could give us a little bit more clarity as to the schedule and perhaps the need for members to keep their schedules flexible through the weekend. I yield.
I thank the gentleman for yielding. First, let me say, no matter how often the gentleman and his colleagues want to say so, we're going to ram through something. No matter how many times the press and public may be misled by that assertion, we're not ramming through anything, I tell my friend. We are following the rules of the House and following the rules of the Senate that have been decades in existence, which have been used when they've been used. 72% of the time they've been used. 72% of the time they've been used, I tell my friend. Your party used them. They are the rules. And we're going to follow the rules. Both bills that are pending before the Congress of the United States have been passed with over a majority, and in fact, the Senate bill was passed by a 60% majority, I tell my friend. Not rammed through, after a full year of debate and discussion, scores of hearings, hundreds of witnesses, thousands of hours of consideration. I tell my friend that you can say that we're ramming something through as much as you want, and it will not make it true. No matter how often it is said by your side of the aisle, who in my opinion wants simply to stop the legislation in its tracks. I tell my friend that we're going to be in the regular order as we have been on these bills since they were introduced. We're going to be in the regular order in terms of considering the passage of bills that have received majorities in both houses. And as I say again, the Senate bill has received a 60% majority in its House. Now, the American public, frankly, expect when we vote on bills, they expect things to pass by a majority vote. They do here. They unfortunately don't in the other body. So that you're going to have 59%, as we have in the House, to give children health care, and children don't get health care. So I say to my friend, we're going to, as I said, the expectation is we'll consider passing health care legislation this coming week. We think it's long overdue. We expect the Budget Committee to mark up a reconciliation bill, as the committee did when the Republicans were in charge on 16 occasions out of the 22 that reconciliation has been used. 72% of the time, as I want to reiterate, because I frankly get a little impatient with this assertion that somehow a process that you utilize 72% of the times it's been utilized, which means that we used it 28%, that somehow now when we're using it, it is somehow now not consistent with the rules. My friend knows it is consistent with the rules, and we're pursuing that process. The committee, I expect, will mark up on Monday. I expect then thereafter the Rules Committee to meet, as is consistent with the rules, to prepare a reconciliation bill to report it to this floor. I expect them to report a rule to consider that reconciliation bill, and I expect that reconciliation bill to be considered. I yield back.
I thank the gentleman. Madam Speaker, all I asked was whether the members should be prepared to be here over the weekend, and I yield.
No, you said a number of things before that, which is what I was responding to. But yes, members should be prepared to be here next weekend.
I thank the gentleman.